Hello, everyone. My name is Maddie Ferrito, and today I want to talk about the complex relationship between major depressive disorder and oral health. Major depressive disorder, or MDD, is a serious and often invisible condition that affects the way a person thinks, feels, and carries out daily tasks. For the dental clinician, it's important to recognize how this mental health condition creates both cognitive and physical barriers to maintaining oral hygiene. MDD affects 300 million people globally, and it's especially prevalent in younger populations, often between the ages of 15 and 30. People living with this disorder may struggle with sleep, appetite, concentration, and decision making. These challenges make everyday routines like brushing, flossing, or even scheduling a dental appointment feel far more demanding than they would for someone without depression. What's particularly important to understand is that this lack of follow through isn't about laziness or poor priorities. Depression reduces a person's emotional energy and motivation, which means tasks that seem simple to others can become overwhelming. Many people with MDD spend more time in bed, have strained relationships, and experience financial hardship. These are factors that make oral hygiene and professional care even less accessible. And when these routines start to slip, feelings of shame or fear of judgment can build up, making them even less likely to reach out for help. On top of that, the condition itself and the medications used to treat it can directly affect oral health. For example, xerostomia is a common side effect of antidepressants, and dry mouth increases the risk of decay, periodontal diseases, and candidiasis. There's also evidence that the oral microbiome changes in people with depression, creating an environment where harmful bacteria flourish. In fact, certain pathogens commonly found in periodontitis, like Prevotella nigrescens, have been shown to trigger inflammatory responses that actually worsen depressive symptoms, suggesting a two-way relationship between oral health and mental health. With all this in mind, our role as dental professionals becomes even more important. Patients with MDD may need an approach that emphasizes compassion, patience, and realistic goal setting. Motivational interviewing is an essential tool for patient improvement. These patients don't necessarily need to be taught repeatedly how to brush or floss if they have not shown improvement in home care. They need encouragement and support to believe that they're capable of doing it. Small, achievable steps are more effective and realistic than overwhelming changes all at once. Providing non-judgmental support can make a huge difference. When a patient who's struggling finally makes it into the dental chair, it may have taken a lot of emotional energy just to get there. A positive, understanding interaction in that moment could encourage them to keep coming back. In many cases, scheduling more frequent recalls can offer both clinical benefits and an opportunity to reinforce healthy habits. It also helps to talk with patients openly about the connection between their depression and periodontal disease, helping them understand that their condition increases their risk and that those risks are manageable with support can be incredibly empowering. And for home care, offering practical tools like soft bristled brushes, fluoridated toothpaste, and physical reminders like Post-its have been shown to help reinforce daily values without adding extra pressure. All of this comes down to meeting patients where they are and recognizing that mental health has a direct impact on oral health. With a little more awareness and intentional care, we can be a source of support for patients who may be facing more than they're able to say. And all that support can make a meaningful difference, not just in their oral health, but in their overall well being. Thank you.